Hello my dear friend. Today we are going to discuss all the recent images and image based questions of our national health program, and I am going to start with this thing that is happening with most of us, that all these things are making our career to its seat, they are making our career in a city way. And why this is happening to most of us? Because in our childhood days we used to love watching TV, and our parents used to make us read mostly, and whenever we get free time we used to watch TV, and that's what make us happy in our childhood days. So now when we grow up, even now we have the same childhood psychology, and even now we love watching TV or mobile phone same as we love in childhood days, and we hate or in a way don't like that much learning thing, and that's make learning less interesting. So let us be conscious of this thing, and then only we can change it. So in the National Health Program's logo, I am like to start with logo of Sankalak. This is the National AIDS Control Organization is collecting data in India in different phases, and this National AIDS Control Program data, is being registered and it is evaluated from 2016 to 2020, and this is known as Sankalak. Sankalak means collection of the facts. So this is just a collection of National AIDS Registry. So National AIDS Registry is giving data, and the collection of these data are presented in Sankalak. Next is that we all know that revised National Tuberculosis Control Program has been changed into National Tuberculosis Elimination Program, and the target of this National TB Elimination Program is that it will eliminate TB by 2025. Because Sustainable Development Goal 3 says that the world will eliminate TB by 2030. But India says that we will eliminate TB 5 years before world target. So that is a good way, a good ambition. So how are we going to eliminate this TB? How are we going to make TB free India? TB harega, desh jeetega. How our country will win? One of the method is this Truenat TB test. You can see this. This Truenat TB test, just like Gene Expert and CBNAT test, they have the capability to detect Truenat TB test just like Gene Expert, or CBNAT. These have the capability to detect not only presence of TB bacilli in sputum, but also detect presence of rifampicin resistance at the same time. So this Truenat TB test is developed in India, and it is a low cost way of detecting two things. So these Gene Expert and Truenat TB test, they both detect rifampicin resistance plus TB bacilli. So if suppose we are having a new patient which is tubercular first line resistance TB is there, resistance, he is suffering from rifampicin resistance or some other resistance along with it. So this can help us in detecting both of it, plus TB bacilli. Now next is, what is the next thing that we are doing to eliminate TB from India by 2025? That is, we are going to give nutrition to all the TB patients, and the nutrition which we give to TB patient is known as by the name Nikshay Poshan Abhiyan. So if they give you this logo in the exam, logo of only N, so this is the logo of Nikshay. And what is Nikshay? I hope you all know. This is a program which was started in May 2012 by Government of India, and in Nikshay program we do reporting and follow up of TB cases, by government and private doctors and hospitals. So how the private doctors will inform our central government about TB cases? By giving messages on Gmail, on WhatsApp. There are various ways by which they can report, and for every reporting they will get 250 rupees from the central government. So this is a program in which we are increasing the reporting. The second program is about nutrition, that is known as Poshan Abhiyan. Nutrition Abhiyan. This is the logo of Poshan Abhiyan, and a growing tree. So when you add both of it, Nikshay plus Poshan, it become Nikshay Poshan Abhiyan, and in Nikshay Poshan Abhiyan there is a provision to give rupees 500 per month, to every TB patient. Why we are giving it? For nutritious food. The problem is, it's a good thing that we are giving 500 rupees, but if you are giving 500 rupees per month, that means you are giving just 17 rupees per day for nutritious food. So this amount will not be able to give proteinous food, and we cannot have good food in 17 rupees. And one tea and one sutta will make, and will be more than 17 rupees, and he cannot have nutritious food in that. But at least government is giving some support, and this money goes to the account of beneficiary when the account is linked with Aadhaar card. Okay, so this is Nikshay and Poshan Abhiyan, and these are some of the way by which we are eliminating TB in our country. And so the fund which was required to be given is not been given, but still we will eliminate TB by some way. So one thing which is resembling to Nikshay is Nishchay. I don't want you to confuse there, that's why I have given it here, Nishchay. Because in Nishchay, as you all must be knowing, this is pregnancy detection kit. Spelling is wrong, but Nishchay. Okay. So Nishchay is pregnancy detection kit distributed by ASA to make female sure of. Nishchay means to be sure of. So it make female sure of their pregnancy, and we want pregnancy to be detected in the first trimester. Because there are 4 visits, which are minimum 4 visits should be there in ANC. The first visit should be within first trimester, and within that first visit, we hope that ASA will make this pregnancy detection kit available to the mother, and they will know their pregnancy. So why Nishchay means to be sure of, so it makes pregnancy sure. And when you talk about Nikchay, Chay is the other name for TB, because in TB our body get wasted, so it is Chay, and Nik stand for no. So no Chay, that means it is no TB is Nikchay, and Nishchay means to be sure of. So if you know the meaning, you will be more sure of your answer. Next thing is, and this is Nikchay Poshan nutrition. Next thing is that this is Anemia Mukt Bharat. I hope you all know about it. The target of Anemia Mukt Bharat is to reduce anemia each year by 3%. Okay, to reduce prevalence of anemia. Actually, prevalence means you all know na, how many cases of this disease is present in the population. For example, among pregnant female of India, around 70% are anemic. So our target is to reduce prevalence of anemia by 3% each year. Okay, as compared to 2015 data, we are reducing it 3% each year. So why we are doing it? Because when we are free from anemia, we have a solid body and a smart mind. So in this Anemia Mukt Bharat, you know that there are 6 beneficiary. Okay, and the doses and everything is something which they keep asking again and again. So just quickly revising it: 20 milligram iron and 100 microgram folic acid is given twice a week. Okay, for 0 to 5 year. Okay, then second group we give 45 milligram iron plus 400 microgram folic acid once a week. These are for 5 to 10 year children. Okay, then in this group, this tablet which we give is pink in color, and of course this is for children, so it is pink in color. Then the third dose is 60 milligram iron plus 500 microgram folic acid, and this we give once a week to adolescent. And when we give it to adolescent 10 to 19 year, the color of the tablet is blue. So pink blue. Now the dose remains same, but this 60 milligram is given in 3 other groups. Okay, one are adult female. In adult female also we give it once a week, and here the color become red. Then is the pregnant female, and then is the lactating female. So that's the 6th group. Okay, now in pregnant and lactating female we give once a day the same tablet for 180 days. 180 days before delivery, 180 days after delivery. Okay, and in adult female we give red tablet, please remember, once a week. Adult female once a week, pregnant and lactating once a day for 180 days. And how to remember the color? It is PBR. Just like we used to go to watch movie in PVR na. So similarly this is PBR. Pink for children, blue for adolescent, red for adult female, pregnant and lactating female. So this 6th group are benefited here. Then there are 6 intervention. That's why Anemia Mukt Bharat is known as 6 into 6 into 6 strategy. Okay, our BJP government, they rhyme very good words and they create very good names and strategies, and very rhyming strategies they create always. So what are the 6 group? You know now. What are the 6 strategy? So along with iron, they are also giving albendazole. How much albendazole? If the age is less than 2 years, it is given 200 milligram every 6 months. If the age is more than 2 years, it is given 400 milligram once every 6 months. And it is not for treatment of iron deficiency anemia or treatment of worm infestation. It is only for prevention. It is a prevention program, Anemia Mukt Bharat. So for prevention, if the age is more than or equal to 2 years, we are giving 400 milligram biannually. That means twice a year. Okay, so first thing is iron, second thing is albendazole. Third thing is that we will try to create a behavior change communication. We will make people aware about the importance of anemia and how it affects their brain and mind. Fourth is that we will use the digital method and we will keep record of all the anemic female, whether they are improving or not. Fifth is we will give fortified food in public health program. We will try to add, for example, iron in salt, so that fortified food can treat anemia at a longer way. And the last, sixth intervention is, along with iron deficiency anemia, we will also try to focus on malaria, hemoglobinopathy, fluorosis, which also lead to anemia. So what are the 6 intervention? Iron deficiency anemia, deworming, digital data recording and all. Fourth is behavior change communication. Fifth is focusing on other causes of anemia. And what was the 6th one? That we will try to add iron in salt and other thing, fortified foods and all. Okay, try to remember the 6 interventions also. Okay, iron, albendazole, fortified food, digital entry. Okay, then we have other causes we are looking as. So these are the 6 intervention. Now what are the 6 institutional mechanism? One is Anemia Mukt Bharat. Then they will try to make interministerial coordination. They will strengthen supply chain. They will converge the ministry. Okay, they will make a national center of excellence for anemia research, and they will make a digital portal for it. So these are the 6 institutional mechanism. Okay, but no one is going to ask the institutional mechanism. They can ask the intervention and the 6 age group, what are the dose they are getting. Next program is Kilkari. I hope you know about it. In Kilkari, all the pregnant female and the mothers, they will send a message on the number registered given by ASA and ANM. ASA and ANM will provide them a number on which they will send a message, and when their message is registered, they will get instruction about good child care and all the good practices. They will listen in their phone. Okay, and on the phone, recorded messages will come from the government that will help them in giving better care to their children. Very big expectations from mothers, especially those who are living in rural area. But at least it will benefit some mother who have mobile. They will get pre-recorded messages about child health care from the government, okay, on their mobile phone. So this is Kilkari. Next is this logo. This is the logo of Bureau of Indian Standards, BIS, and it was asked in a recent exam. Then what is this logo? In this logo, you will find Arogyam Sukh Sampadam. This is the logo of Ministry of Health and Family Welfare, MHFW. That means in good health lies all the wealth and happiness. Okay, Sukh Sampada. Okay. Now what is this? This is civil registration system for birth and death. And this is a very simple and interesting logo, because you can see the black one is the death and the green one is the life coming out. And we should register all the birth and death within 21 days under the civil registration system. Otherwise, there will be some minimal fine and you have to get sign of many people. So that we make this timeline so that most of it get registered on time. This is a blue circle which is for diabetes awareness, blue circle. Now this is our employee state insurance scheme, ESI scheme, which was started in 1948, and under this ESI scheme there is a 3 types of simple plain benefit. One is sickness benefit, which is for 91 days. Then is the extended sickness benefit, okay, and extended sickness benefit is for 2 years with 80% pay, okay, and it is 91 day with 70% pay. Next is this logo, and then also for tubectomy and vasectomy, we get enhanced sickness benefit, which is for vasectomy, this is 7 day, for tubectomy, it is 14 day. And in this case, we get 100% salary. Of course, for the maternity, the leave is 26-week leave for maternity benefit. And this is, of course, very less than what is needed for a mother, okay, because 6 months is the pregnancy duration. Then for next 6 months, you have to breastfeed. So it should be more, but it is 26 week. And right now, there is no paternity benefit. What is this logo? This is the logo of Janani Shishu Suraksha Karyakram. You can see the mother and child both. So this is the Janani, the mother, and this is the Shishu, the child, and they are protected by giving 3 things free ambulance, free food for mother and 1 attendant for 3 days, and free treatment for mother and child up to 1 year of age. Next is, and there is no logo of JSY. J.S.S.K has the logo, JSY has no logo. In JSY, only one thing happened, money is given, but it is given after delivery to Asa and mother for hospital delivery, okay. This next program is mCessation, okay. They are not trying to make you free from your mobile phone, and mCessation is for cigarette smoking cessation. If you want to quit smoking, you can send a SMS on this number, and they will give you gyan, they will give you pre-recorded messages on how to quit smoking on your phone, and by listening to them, you can quit smoking. So easy, okay. Anyway, quitting cigarette is very easy, I have quitted cigarette like I think 7-8 times I have already quitted it. Right now also I am not smoking cigarette for last 12 or 15 days. Quitting is easy, but it comes back. Now Anmol, so try to quit it permanently. This time I hope I will quit it permanently. So this is Anmol, which is a very ambitious goal of Government of India to have online data entry by every ANM. They want this software to be uploaded in the iPads, which will be given at PSCs and sub-center, and it is expected that ANM will do data entry into directly into this software with the help of Anmol software, and that will be very good, because then we can save a lot of data which is lost, because everything will be online, then it will be forever mostly, okay. So Anmol, what is it? It is a software for data entry by ANM, okay. So this software will help the data entry programming and other thing by an ANM which is present at sub-center. So this is for ANM. What is for ASA? That is known as Mobile Academy. In this Mobile Academy, ASA will give a missed call at this number 180030101704, and then ASA will get classes on phone, training program on phone, okay, which ASA will listen very sincerely, and then ASA performance will improvise just by listening to those training classes on phone, okay. Very ambitious vision of government. So this is Mobile Academy, but at least it will help some ASA who want to learn. And okay, so Mobile Academy is training program for ASA. Anmol is software for data entry by ANM, okay. And Kilkari is pre-recorded messages for childbearing and given by Government of India and to mothers. So there is Kilkari, Mobile Academy, Anmol, okay, mobile cessation. These all are mobile related program. One more mobile related program is 99 dots. Okay, this 99 dots is to increase compliance to ATT, anti-tubercular therapy. There is a secret number which will be written behind the wrappers of TB drug. So when patient will eat the tablet, they have to send SMS, and this SMS will go to the central directory as well as it will go to the dot provider like ASA. So if a patient send SMS on a hidden number, okay. So this send SMS to dot provider, they will send SMS to dot provider about hidden number. The hidden number is there behind the wrapper, which patient will see after eating tablet, and then they have to send that hidden number by SMS to the dot provider. If dot provider will not get this SMS, okay, which patient has sent of this hidden number, then dot provider will know that patient is not eating tablet, and they may go and inquire, why are you not sending tablet? Then the patient will start eating tablet, and there is a chance that it can increase the compliance. So this is the way which government is thinking to increase the compliance, that is 99 dots. This is Mobile Academy. What is this logo? In this logo, you can see a mother and a child sitting in the lap. So this is the logo of Anganwadi program, and this is also the logo of ICDS program, Integrated Child Development Services. And under Integrated Child Development Services, we all know we have two programs, midday meal and Anganwadi. So ICDS and Anganwadi both have the same logo of mother and child sitting in the lap. Midday meal has a separate logo. This is the logo of midday meal. You can see children sitting one after another, girls after boys, and with plates in their hand. So this is the logo of midday meal program. Now this ICDS program, does it come under Ministry of Health and Family Welfare? No, it comes under Ministry of Women and Women and Child Welfare. Okay, Ministry of Women and Child Welfare. Okay, so child welfare and child care are the same thing. So Ministry of Women and Child Care, they look at ICDS program, not Ministry of Health. So that's why if you are posted at a PHC as a doctor, you don't have a direct control over Anganwadi, and you will interact with Anganwadi worker, with CDPO also, because this is the mechanism by which Anganwadi work. This CDPO is at block level. This is known as Child Development Program Officer, and this CDPO, they interact with Mukhya Sevika. Each Mukhya Sevika look over the work of 4 Anganwadi worker. Okay, Anganwadi worker. So under one CDPO, usually there is 25 Mukhya Sevikas, and under each Mukhya Sevika there is 4 Anganwadi worker. So by this they are coordinated, and as a doctor we will coordinate with CDPO or Mukhya Sevika, and we will try to work with Anganwadi worker if you want to improve the nutritional condition in the village. Next logo is this health in your hand. What does it mean, health in your hand? It means do not smoke, do not drink, then you will be prevented from non-communicable disease. So this is National Program for Prevention and Control of Diabetes, Heart Disease, Stroke and Cancer. Because previously cancer was a separate program, then it was also included in NPCDCS. Okay. Then this, what does this logo, which program has this logo? Child Health. This is the logo of INAP program, India Newborn Action Program. Okay. And under this program, we try to decrease the infant mortality rate of India by giving 3 types of facility. First is Newborn Care Corner, which is 1 bed at PHC. Second is Newborn Stabilization Center, which is 6 to 8 bed at CHC and first referral unit. Okay. And last is Special Newborn Care Unit, which is 12 bed at district hospital. So these 3 things, Newborn Care Corner, Newborn Stabilization Center and SNCU, are formulated in government hospital to decrease infant death. This is INAP program. Next is this Rashtriya Bal Swastika Karyakram, in which Ayush doctor will go and visit Anganwadi and government school, and they will try to screen for 4D, deficiency disease, diseases of childhood, disabilities and congenital deformities. Okay. So they will look for these things, and they will not screen for congenital glaucoma. They cannot screen for zinc deficiency, because they are Ayush doctor. So they cannot screen for those things which need a special instrument. And you cannot screen zinc deficiency without instrument. You cannot screen glaucoma without instrument. So they will not screen those diseases. This is Rashtriya Kishor Swastika Karyakram, adolescent health program. Okay, logo. Next is this Pradhan Mantri Surakshit Matritva Abhiyan, in which government of India will give free ANC checkup, okay, on 9th of every month at government hospital, okay. But government forget one thing before launching this program, that any day on the month, every 30 day, ANC checkups and drugs are free already in government hospital, okay. So it was already available at government hospital. Government is not giving anything on 9th, but they declared a new program saying I will give it free on 9th, okay. Then this is the older program by Congress, RSBY, Rashtriya Swastika Bima Yojana, okay, in which 30,000 money is given for every BPL family if they want to get treatment in secondary and tertiary care, private and government hospital, okay. It is still run in some states, okay, and if the illness is more than 30,000, you can increase it up to 1.5 lakh. So this is RSBY program. And then when the new government came, then they started in September 2018, they started Ayushman Bharat program. And under Ayushman Bharat, you have two components. One component is this Pradhan Mantri Jan Arogya Yojana, in which 5 lakh insurance coverage is given for every economically weaker section family which are earning less than 7,000 rupees per month, okay. And this money is not given to them. If they will fall ill, they will go to a hospital. They have to pay the cost of the consultation from their pocket. If the doctor write any medicine, that medicine cost will also not be given by this program. If the doctor write any test, that will also not be covered by this PMJY. But if the patient got admitted, he needed treatment or surgery or anything, that will be covered by this insurance card, okay. So all this money will go to private insurance company, then they will refund those money to the hospital in which patient was treated, okay. So it started in September 2018, and one of the program was PMJ, this insurance, and second part of this is Health and Wellness Center, in which government is planning to make 1.5 lakh health and wellness center, okay, with very less fund. So it is expected that they will rename the PHCs and sub center as Health and Wellness Center, and by adding Health and Wellness Center, they are willing to add two extra things. One is they are definitely willing to add yoga, because yoga se hoga, and second is they want to add the component of mental health, okay, which is a big challenge, but they want to add yoga and mental health along with NCD care, which is given at PSC, along with maternal and child health care, which is given at ANC. They want to add yoga and mental health also. So this is Ayushman Bharat. This is the logo of Arogya Nidhi. And now she was standing on one leg, and it was also a financial assistance program started during Congress regime. But even Congress did not funded it well, so it fell from that one leg. Okay, it does not work well. It was same as RSBY, Rashtriya Swastika Bima Yojana, but it was not being funded well, so it did not work. Then this is Rashtriya Vayosri Yojana for more than 60 year, more than 60 year, not equal to more than 60 year people, more than 60 year BPL people, family, not people who are more than 60 year. What they get? They get hearing aid, wheelchair and other assisted living devices under this Vayosri Yojana. Vayosri means old age sort of thing. We all know this is the logo of National Leprosy Elimination Program. Okay, it is not talking about Congress and BJP, and both of it in one logo. It is saying that by getting proper treatment by multiple drug therapy in leprosy, every leper patient who is not so well can glow and bloom like a lotus flower. Okay, so that's the logo of National Leprosy Elimination Program. And we say elimination if there is less than one case per 10,000, we say that leprosy has been eliminated. That's why India has eliminated leprosy in 2005. Okay, now this is Mission Indhanush, and the only child happy with an injection. And in this program, government is giving vaccine for 7 vaccine preventable disease. So the common question that they ask is, which of the following disease is not included in Mission Indhanush? So it's very simple to remember. First, DDT are the 3. Okay, then there are 3 vaccines which are given at birth: hepatitis B, BCG, and OPV. So 3 plus 3, 6, and the last one is measles. So these 7 diseases were initially covered under Mission Indradhanush. whose target was to make every child immunized by 2020. Of course, it was not covered, but we are very close to getting 100% immunization. This is IDSP program, Integrated Disease Surveillance Program, Integrated Disease Surveillance. So how we are going to do integrated disease surveillance? There are three ways to do it. One way is that every disease which is new should be reported within 24 hours. Report within 24 hours. Suppose case of Ebola emerged in India, let's say. I am not expecting, let's say. So it has to be reported within 24 hours from PHC to Delhi, to the center. And how this reporting is done? By integrated disease surveillance. So in this program, there are three types of form. SPL, okay. In the S form, what we write suspected cases which are detected by field worker, detected by ASA or health worker or ANM. So these are S, these are filled in S form. Then we have P form. P form stand for probable case. This probable case are those which are detected by MBBS doctor, mostly at PHC. So they are known as medical officer in charge, mostly MBBS doctor. Then there is L form, which is for lab confirmed cases. This is the one on which we rely the most, of course. So in these three forms, we fill all the cases that are reported at PHC, and we send this report every week to the higher center. At least twice a month the report must be sent. But if any outbreak happened, any new disease emerged, then the reporting should be done within 24 hours. So these are the reporting format which we use. Then to know whether NCD is increasing or decreasing in our country, and to know whether someone belong to high risk group for NCD or not, okay, high risk group for non-communicable disease, and trend of NCD. If we want to know these two things, that whether NCD is increasing and whether you belong to high risk group or not, we will ask three level of question. The first level of question are the psychological questions, in which I will ask to you that, do you smoke? Tell me. Do you drink? How many times you exercise? What is your diet? Because these are psychological factors which we can control. Believe me, we can change these things. But if these things, all the four things we are doing, not exercising, and diet is not good, and smoking, drink is present, it means we are high risk group for NCD. Okay. Then after psychological, we ask physical factors question. And the physical factors questions are like, what is your age, what is your BMI, what is your BP, okay. If anything is raised, you are NCD, high risk for NCD. Last is hormonal or biological questions. In biological or hormonal question, we take fasting blood sugar, random blood sugar, okay. In developed country, we also measure lipid profile and thyroid profile. So by these three level of question, we will know how many are at high risk and what is the trend of NCD. This is our Beti Bachao, Beti Padhao, Andolan, okay, movement. So we are not giving much fund to female education in this program. We are mainly just spending money on advertisement, and we are not talking about dowry system in this program. The very basics of why female are oppressed is because they have dowry is being paid in every marriage, and then female is being compared with material thing, and their value of female is compared with how many dowries he bought. This is one of the basic reason for female operation. We do not talk about this dowry in this program. We only do not give money on female education. We only advertise that we should protect. We always make people remember that they are endangered species. They should be taken care of, okay, without giving fund for education, other things. So this is our next program, National Niti Ayog. It was formulated in 2014 in place of Planning Commission. The full form of it is National Institution for Transforming India, and its main purpose is to increase private partnership in public sector, okay, for better or worse of India, okay, whatever thing which will result. Then they can ask some question about the life cycle. For example, this is the life cycle of hydrated cyst disease. In hydrated cyst disease, in the dog, the adult form lies. Okay, you can see the adult form present in the dog. Then this dog will do the sit poop, which will be eaten by some sheep, which is the intermediate host. And then from the sip, the cyst can again go to the dog. In between, the embryonated egg in the feces can also enter human, and then it will reside in the liver and cause the hydrated cyst disease, and it can go to the various body part also. So this is the life cycle of hydrated cyst disease. In the recent exam, they asked the life cycle of leptospirosis, which is this. In this, of course, from the urine of the of the rat, urine and feces of rat, which will infect the water during flood time or in general also, then that water or soil will be taken by the man, and we will suffer from leptospirosis. And from us, the infection can go to animal, or from animal the infection come to us. And that's why this leptospirosis is something which is a common illness during flood, because then the urine and feces of animal mix with our water and food supply. Okay, and in leptospirosis, the treatment which we give is capsule doxycycline 100 mg 3 times a day for 3 days, 3 times for 3 days. And especially during Kerala flood, government has said to distribute this capsule doxycycline 100 mg 3 times a day for 3 days to everyone as a prophylaxis of leptospirosis also. This is the life cycle of, what is this? Can you appreciate this animal? This is the pig, and a cute little pig. And this is the life cycle of Japanese encephalitis. So please remember, in Japanese encephalitis, this ardid bird, it acts as a maintenance host or reservoir, okay, which store it. And then Culex mosquito bite the ardid bird, the reservoir, and transmit the infection to pig. And pig is the amplifying host. It amplifies the Japanese encephalitis bacilli, virus. And then from the pig, it can go to human, which is a dead-end host. That means from one human, suppose I am infected with Japanese encephalitis, it cannot happen that a Culex will bite me and infect other human. The infection will not go from human to human. That's why I am a dead-end host. So who is the amplifier? Pig. Who is the reservoir? Ardid bird. I am the dead-end host. Okay. So these are some of the life cycle which they also ask. Then these are the questions from the recent health programs logo, and there is one more health program logo known as Kayakalp. Okay, I should have added it here. And this Kayakalp is for improving the sanitization and cleanliness of government hospital. This is Kayakalp program for improving the cleanliness in government hospitals. Okay, government hospital cleansing. Okay, and of course we know about Swachh Bharat mission, which is symbolized by 2 glasses of Gandhiji, which aim to make India open defecation free by 2019. Okay, that was the Swachh Bharat mission. Okay, so along with it, we can also quickly revise the confusing logos coming from contraception and family planning. And there are some other logo also which I want to tell you. If they give you this logo, this is the logo of which program? Can you tell me? This is the logo of Baby Friendly Hospital Initiative, because we know that there is 10-point guideline which is given to every hospital to promote breastfeeding among mother. Okay, and you know those guidelines. One is to have as early breastfeeding as possible, kangaroo mother care. Second is they ask the mother who have delivered to sit in a group together. 5-6 mothers, suppose they delivered, they will sit for 1 hour along with their baby and they will try to breastfeed. So that if any mother is having any problem in breastfeeding, that can be sorted with the help of other lady who is breastfeeding well, or they will get to know about each other problem, so they can solve it and they can tell it to the responsible doctor. So this is Baby Friendly Hospital Initiative for breastfeeding. Then similar program is Ma, Mother's Absolute Affection, ek Sankalp. What is the motive of Ma? To promote early and exclusive breastfeeding. Okay, to promote early and exclusive breastfeeding. Okay, but exclusive breastfeeding. Okay, so we should always try to promote it. But in case of cesarean section delivery, sometime you need some milk support from the artificial milk support like cow milk in the initial time, and then when the mother is prepared to breastfeed, then the breastfeeding is start. But this is not in the guideline. Ideally, we should try to have as early as possible breastfeeding within 1 hour, probably in case of cesarean section also. So next is the logo Mission Parivar Vikas. The aim of Mission Parivar Vikas is to have less and less children in the family, and therefore they promote DAMPA. What is DAMPA? Depot medroxyprogesterone acetate, which is given intramuscularly, and it protects for 3 years. Okay. So this is one component of Mission Parivar Vikas. Then they also try to have communication between mother-in-law and daughter-in-law, so that they can come into one common point that how much children are good for the family development. That's why they call it Mission Parivar Vikas. And this is one of the injectable contraceptive, medroxyprogesterone acetate. So this is depot medroxyprogesterone acetate. So this is MPA, DAMPA. The dose is 150 milligram. It comes by the name of Antara Karyakram. And of course, it gives protection for 3 months. The only problem is that because for 3 months, a constant hormonal supply will be there. But in case of OCP, they give a gap in between for regular bleeding, and there is no gap. So many a time with IM injectable contraceptive, the irregular bleeding and spotting can be there. Okay. And sometime in regaining fertility, a delay can happen by 6 months to 1 year. You understand? Suppose I am taking this injection, DAMPA. Suppose I am a female, okay? And when I am taking it, now I want to have a child. So I will discontinue it from today. It may happen that for next 6 months to 1 year I cannot become pregnant, then I will become pregnant. So it can delay the regaining infertility by 6 months to 1 year in some cases. Okay, so this was one of the component of Mission Parivar Vikas. Okay, this was the Mission Parivar Vikas. Now, what is the logo of our family health program and family health planning program? This is the logo of family health planning program, okay, family health program, in which we try to have as less children as possible, probably 1 child if is better. And the logo is Jodi Jimmedar Jo Plan Kare Parivar. That couple is responsible who plan their family. That's why it is Mission Parivar Vikas. Because if we plan our family with less member, then our family will develop better. Okay, so that's the logo. Okay, family health program have this logo. Then this is an image of NOR plant, which is again an injectable contraceptive in which 6 Cialistic tube is inserted intradermally. It is inserted, you can see the tubes are inserted in this place, it is inserted intradermally. Okay, and it gives protection for 4 to 5 years depending on the brand. So this is the NOR plant. Again, injectable contraceptives comes under it. We all know this is female condom because female condom has 2 rings, male condom has 1 ring. I don't think I need to show you male condom, you know that. So this is 2 ring and it is made of polyurethane. Okay, because male condom with 1 ring is usually made up of latex. 1 ring and it is made up of latex. And this is made up of polyurethane. Now the failure rate, which is measured by Pearl index usually in 100 women year. This failure rate, if you measure in male condom, it is less 2 to 1400 women year. But in female condom, it is 5 to 2100 women year. So female condom has a more failure rate made up of polyurethane. It has 2 rings. Okay. And this was the logo of family planning program. Family planning program. Then what is this? What is this? You will say it is copper T and you will be wrong. This is hormonal IUCD, not copper T. Hormonal IUCD come under 3rd generation IUCD. So how does a copper T will look like? This is a copper T. In copper T, the wire will be like this and it will look like this. And we all know that copper T 380 Ag protect for 10 years. Okay. if you talk about hormonal contraceptive, one common example is Progestasert, and this Progestasert will protect for 1 year. Okay. Then we have Mirena. Mirena give protection for 7 to 10 years, and this is also a third generation hormonal IUCD. Okay, and this is in fact an image of a Mirena, this image which I have shown here. So Mirena will only plastic, copper T will have copper wire on it, and if it is 380 Ag, it is second generation. Other second generation, I think you know, Nova T, copper T 200 Ag, and multi-load 375. All these 4 are second generation, and these 3, copper T 200, Nova T and multi-load 375, they all protect for 4 to 5 years. Okay, so these are second generation IUCD. Now what is this? Is it copper T? Answer is no, this is multi-load 375. It is also, remember, multi-load 375 is not third generation. Multi-load doesn't have hormone, it is only second generation, don't get confused. And with spikes it is multi-load, with spikes and copper, multi-load. With only copper, copper T, with no spikes, no copper, that is Mirena, third generation hormonal IUCD. Then this is a Chaya tablet, Centchroman tablet, which is, you all know, non-steroidal oral contraceptive pill. So this comes by the name of Chaya. Okay. Now main thing they ask is, and we forget, is that how to take Chaya. It is written in the drugs itself that it is twice a week for first 3 months, then once a week after that. First 3 months twice a week, then once a month. This tablet has to be taken, and it is good in many ways because the side effects are not so much. This is the logo of Mala D. Previously, Mala D and Mala N, when they were formulated, then in Mala D we have desogestrel, Mala N we have norgestrel. But now it is not the case. Both Mala D and Mala N have same composition. They both have levonorgestrel and ethanyl estradiol. How many is ethanyl estradiol? 0.03 milligram. Okay, or you can say 30 milligram, 0.03 milligram or 30 microgram. And how many is levonorgestrel? 0.15 milligram or 150 microgram. Okay, because both Mala D and Mala N are normal dose OCP, so in them the ethanyl estradiol is 30 microgram or 0.03 milligram. If it is a low dose OCP, what is the difference between low dose and normal dose? In normal dose we have 30 microgram ethanyl estradiol. In low dose OCP we have only 20 microgram ethanyl estradiol, or you can write it 0.02 milligram ethanyl estradiol. If it become 20, it is low dose. If it is 30 ethynyl estradiol, it become normal dose. In 20 microgram, what is the dose of progesterone? Again the same. In low dose OCP also, the dose of levonorgestrel or progesterone is same, 0.15 milligram, and or you can say 150 microgram, and only difference is in the dose of ethynyl estradiol. Example of low dose OCP is Femilon. Tablet Femilon is low dose OCP in which ethynyl estradiol is not 30, 20 microgram. Then we should also see the logo of Mala N. And the brand name is Sasa. It can come with different brand name. So again, in Mala N also you can see the levonorgestrel and ethynyl estradiol is there, along with ferrous fumarate. So the composition of Mala N and Mala D are same, no difference between them. Okay, levonorgestrel dose 0.15 and ethynyl estradiol dose 0.15 milligram, and it is 0.03 milligram. Okay, the same dose. So these were some of the logo. Antara is for Dampa. These were some of the logo which I wanted to tell you. This is the logo for Skill India program. Okay, Skill India program. And then let's these are the logos which I wanted to show you for recent programs. Now let's end the discussion, and before ending the discussion, make it sure that we do not fall in trap with these two little friends who are trying to make our career go low. We will remain conscious and we will try to search for real happiness. Real happiness comes when we grow in terms of our knowledge, when we grow in terms of our relationships, our parents feel proud of us. These all are real happiness. So if we know what is our real happiness and what is childhood wishes and all, then probably we can get rid of those things. So let's keep fighting. We will never win 100%, but at least our attempt should be there in that direction. So because I am also defeated many days, okay, I also get attacked by these two dogs, but we should keep fighting. So thank you very much for listening. I hope this discussion is useful for you. Hasta la vista, das vidania. Thank you.